in urology at least four entities or four subjects which actually have been missed out completely, only for the sake of lack of awareness, lack of pure knowledge, and the difficult subject that they are in. The treatment available is not much across the country and the world. Friends, when we look at refractory states, when we look at states where the issues in urinary, sexual health, issues in bowel and bladder is not taken care of by medicine or by understanding that 1 plus 1 equals to 2, there are changes happened which are beyond the realm of corrections and therapies by medicines and by surgery. Some entities which probably don't recover completely by attempted therapies today across are at least grouped together as refractory fecal incontinence. Somebody leaking motions, stools in their diapers. And it could be age group of anything between 15, 25 to 40 and 70. Somebody having a refractory overactive bladder, a bladder which is grossly overactive and contracts erratically, contracts to its own tune and doesn't listen to the master. Attempts on medications, attempts on behavioral therapy, attempts on botulinum toxin may have failed. And the urodynamics shows a refractory overactive bladder, a bladder which contracts erratically. The third entity is the refractory underactive bladder or a hypotonic bladder, a bladder which doesn't have the power to contract and push urine out. Don't forget that the great understanding in the lower urinary tract is about bladder gradually filling up without major sensations and disturbance till a point in time when it fills to its capacity. And thereafter makes you go to the washroom. The bladder contracts, the passage opens and urine comes out. During this phenomena, if the bladder stops contracting and sensing, then the bladder stays full. You may have lesser sensation. When you pass urine, you pass with straining because the bladder does not strain with its muscles that detrusor. Abdomen strains and pushes urine out. These people could be having refractory hypotonic bladder or hypocontractile bladder. People with long-standing diabetes, people with spinal injuries, people with spinal dysraphisms which are not picked up by any other test till we do an MRI, and people who have had past strokes where recovery has happened to a point in time and not beyond that, they still need catheter as a way of life. So all hypotonic bladders, all refractory hypotonic bladders which have no contraction powers, or powers are less, not enough to be able to push the urine out through the resistance pattern of the urethra and the sphincters, deserve a kind of help. And unfortunately, the help can either be a catheter or a suprapubic cystoscopy in many of them, and many of them who don't know want to come out of entrapment. So friends, this awareness drive today is to address four important aspects. Refractory chronic pelvic pain of undetermined origin arising from, again, the spinal nerves. Refractory overactive bladder, the reason where the bladder contracts erratically and does not listen to its master. And the contraction is such that attempts at all with your urologist, with your gynecologist, with your physicians on behavioral therapy, on therapies of overactive bladder, which are medical management and combination therapy of beta-3 agonist and antimuscarinics of the past. And then also attempted botulinum toxin, which is a temporary decascading mechanism of the cholinergic receptors out in the bladder, which gives a result of anything between 6 to 9 months before the re-sprouting happens of the nerve fibers and nerve bundles again to bring them back to incontinence. And that's refractory to all these attempts as refractory overactive bladder. And then there is refractory fecal incontinence related completely a lot to the neuromuscular mechanisms rather than to the sphincteric injury of the fecal control. And finally, the refractory case of refractory hypotonic bladder or the bladder not contracting, not able to push urine out, and you have to live on self-catheterization 4 to 5 times a day, or you may have to live on a catheter, which could be indwelling catheter, recurrent urinary tract infection, or suprapubic cystostomies. So friends, for all these four entities, the neuromodulation has done wonders to these patients. Neuromodulation by a sacral neuromodulation device, which from Medtronic comes as InterStim X today, which has a battery life for 12 to 15 years, allows the individual to have a pacemaker in the pelvis. I would call it as a pacemaker because if the heart does not contract supposedly normally, then the body does not move forward. The body is in trouble. Similarly, if the pelvis does not have a coordinated contraction, a pacemaker in the pelvis, by stimulating the sacral 3 nerve that I do at the Kokilaben Dhirubhai Ambani Hospital on either side. It could either be the right or the left. Best tested uh, kind of impedance that is checked on the operating table under a mild sedation or under local anesthesia gives us an idea as to that would last. Over the last few months, individuals from 15 to 70 years living with these four entities: refractory fecal incontinence, refractory overactive bladder, refractory chronic pelvic pain not responding to anything from epidural analgesia to various anesthetic procedures that have been tried, and finally refractory hypotonic bladder. The four indications have found their match in the last 7 to 10 cases, where we are able to actually bring them back onto the main road from the footpath by the way of churning, looking at their sensations being modulated. And what can best happen if a sacral nerve 3 is modulated properly? The leads are placed initially as a tine lead in the test procedure, which lasts approximately 30-35 minutes, or under local anesthesia, and the leads are well placed, fixed, for you to go back and look at this modulation drive of various programs that are modulated to a point in time where you actually get the desired result over the next 10, 7, 10, 15 days till the battery lasts. Plus, we need to change a battery. And that is the test of time, starting from the very lead modulation on the operating table to the changes which you see on all the four entities, which happen to be indications to me for sacral neuromodulation at the Kokilaben Ambani Hospital. For mature men suffering with quality of life on the fecal, urinary, and the pain dysfunction in the lower tract in the pelvis, by applying a pacemaker in the pelvis has actually worked wonders. So this is an awareness drive for many men, many women who live in agony. Agony even of chronic pelvic pain, which has been idiopathic and nobody has found a reason to it. You're living with pain, pain, pain all the time in the region of the pelvis, undefined, attempted therapies, medication, change doctors and cities. Similarly, overactive bladder, where you live a life on diapers because you have an urgency urge incontinence which doesn't look at time, day, location, airport, market, home. And therefore, you need to live a life on diapers. You leak around. Attempted therapies by your colleague, urologists, and doctors have not helped. And then you have refractory fecal incontinence as a result of various spinal issues, which could be vascular trauma, which could be a spinal stroke related issues. And finally, refractory hypotonic bladder, where a life has to be spent by the emptying mechanism gone wrong, can all be modulated. Friends, the InterStim X has come with the battery life of more than 12 to 15 years compared to what it was in the past, where I used to implant InterStim 2, where the implant would only last approximately 3, 5, 7 years. I don't think 7 years, but 5 to 6 years is what was said. And the battery is required to be changed in that era. So era has dramatically changed, and so much so that requires aspirations and dreams of patients too. And therefore, individuals who live with disease are today treatable. Are today treatable and curable by the way they can best approach this entire entities, which require a pacemaker in the pelvis. So if there are individuals who suffer from these four entities again, which is refractory fecal incontinence, refractory hypotonic bladder, or a bladder does not contract and you have to live a life on catheter or on self-calibrations. Third is refractory overactive bladder, where you continue to live a life on diapers, leaking urine, medications are to the dose required, which only cause side effects, and botulinum toxin has been attempted and failed. Are individuals along with chronic pelvic pain, where there's undetermined etiology of pain. The results have been wonderful, life-changing, life-modifying, life-saving for those individuals who lived a life on agony and disgust and despair as to why me and when I would come out of entrapment. So friends, sacral neuromodulation has come to stay. It is very much a treatment. Obviously, it's a very niche area treatment. We need to be very careful when we do that. Sessions of counseling, planning, and doing a two-stage therapy, proving that this will work in individual right on the operating table itself, right in the neuromodulation phase of the first 2 weeks, and taking logically to conclusion to all these individuals is an important awareness for all men, women who listen to this today, and for all doctors who go through their patients not getting relief on these four aspects. It's important for us to work up these patients, look at their urodynamic, look at their sphincteric EMG as required in individual case as an MRI, studying them, looking at their voiding diaries, looking at their diapers being abolished, giving them a life of cure is what is a dream from this channel, from this attempt where awareness goes high for all individuals who deserve to be treated on various aspects of urology and andrology. Thank you so much.